There we go. All right, here we go. So we'll start with introductions. So my background is that I'm a fourth generation naturopathic doctor via my family in Germany, and took my pre-med studies at University of Toronto, followed by the 4-year doctoral program at the National College of Naturopathic Medicine in Portland, Oregon, graduating in 1983. And in 1984, I wrote 3 days of grueling board exams and have been practicing here ever since. Currently, I am directing and practicing at the Carpridge Eco Wellness Center, which I founded in 1997. So the Carpridge Eco Wellness Center is on 190 beautiful acres, half an hour from Ottawa, and it offers various possibilities for people to heal. We have a natural health clinic with a team of holistic health practitioners who work together in helping people reach their health goals. We have a bed and breakfast, which has organic beds and healthy food, and it's a place where people can stay, get their integrated assessment, and a treatment plan to take home. It's one of the few places in North America where you can get all of this in one place. We have different programs and events. We have weekly meditations, yoga class. We have retreats. We have group, which is pretty unique as well. We have a naturopathic group where people can come, and it costs $20 a month, and ask questions about their conditions. And we share little healing techniques and do them together. And we've developed quite a lovely, supportive group. And finally, there's the land. We have trails that crisscross the land, and people can wander on the trails and sit and meditate and watch the wildlife, and that alone is healing. Recently, we also restarted the movement towards opening up towards an eco-village. So that's pretty exciting as well. Overview. So we're pretty aware of quite a few factors that cause disease. Poor diet, stress, lack of exercise, sleep deprivation, poisons, toxins. But German New Medicine, or GNM, brings a new concept, and it's a very specific concept where a trauma of a certain type will cause very definitive symptoms and conditions. So we'll start with the background and move towards the 5 laws, which are the underpinnings. And then we'll talk about how to use GNM in everyday life, and also when you're trying to use it to help solve a condition. You'll get a list of further resources, and then we'll move into the questions and answers. So, background of German New Medicine. Basically, the background is Dr. Hammer, a medical doctor and internist from Germany, a visionary, a practical genius. Unfortunately, we lost him 3 summers ago. And in 1978, his youngest son was actually accidentally shot, and he died. And after that, Dr. Hammer developed testicular cancer. And he correlated this terrible shock with this cancer, and then had the further question of how is my brain relaying this trauma to my body? And as he was working in a cancer clinic at the time, he started taking brain CAT scans of all of his cancer patients. And he found these ring formations. They're called target rings in medicine, and they're concentric circles that look like a target, basically. And radiologists to this point had always assumed that these rings, because they were so perfectly shaped, were reflections from the machine. And Dr. Hammer did some studies with Siemens, the CAT scan manufacturer, and they certified that these lesions were not indeed reflections, but biological in nature. And so then he went on to study the progression of what happened from the shock on through resolution and watch these new patterns. I mean, they're old patterns, but he saw them in a new light. And he described these 5 new laws that we're going to go through. And they reframe the onset, progression, and healing of what we think of as disease. And Dr. Hammer saw thousands of patients and did research to show that these were totally viable, that German new medicine was totally solid. And we have been seeing the same thing in our practice. And now German new medicine practitioners practice and teach this all over the world. And it's growing quite exponentially as people learn about it. And you'll see why. So my personal introduction to German new medicine, the turning point of my life happened in the year 2000 when my new husband, my second husband, Mickey, developed seizures and was diagnosed with brain tumors. We started using naturopathic medicine, then did brain surgery. And in the middle of all of that, one of my patients handed me Dr. Hammer's first book and insisted that I read it. And I was so inspired by what I read that I went to find Dr. Hammer and found Ilse-Dora Laker, one of his close students. And she became my mentor and remains my mentor to this day. And through her, we were able to have a consultation with Dr. Hammer over the phone. And he explained that Mickey's 3 brain tumors were related to 3 shocks and 3 physical body parts: heart, kidney, and left testicle. And we tried our best to use it, but didn't succeed. We lost Mickey in February of 2002, but his autopsy showed the lesions in the heart, the kidney, and the left testicle, just as Dr. Hammer had predicted. And that catapulted me into studying German medicine quite intensively for a year. And I had tons of questions, 7 pages, single spaced, and all of them were answered. And I ended up then integrating it into my naturopathic practice. And right away, we started having startling results, especially with cancer. And that was 2003 to the present. And finally, I was able to publish a book last year detailing some of these case studies and also explaining the laws. And there are a lot of other points about German new medicine. The laws are just the beginning. So there are many, many more things, hours and hours. So this is just a bare bones introduction. But I wanted a small book that people could understand to see if they wanted to use it. And even more importantly, I wanted to stimulate some research in the medical community. And out of all of that came an integrated program of German new medicine and naturopathic medicine, including the inpatient program that we have with the bed and breakfast. So German new medicine law 1 states that biological shocks create lesions in the brain and simultaneous effects in the body. So we have to start by asking, what is a biological shock? And that is an unexpected and intense surprise that on some level threatens our survival, or at least it does to our old brain. And it's almost like the rug is pulled out from under us. Now, we already know that traumas predispose us to disease through research on cancer and childhood trauma. But German new medicine gives us very specific connections between shocks and their physical manifestations. So one example that I usually use is if somebody has a death shock, and then our primary requirement for life is breathing, is oxygen. So our body responds by developing more cells in the lung so that we get more air into our system. So this is what I mean by the next sentence, that these physical symptoms are actually trying to help us with the shock. So lung cancer is actually trying to help us. And it was started by the emotional fear of death. And it can be for ourselves or somebody else. And so the emotional work that we would do for a lung cancer would be to resolve that fear of death, either for ourselves or someone else. And once we resolve that, once we no longer fear that death, those cells will stop growing instantly. Similarly, if it's for somebody else and they die, it also will stop. There's the story of Superman dying of, I think it was cancer as well. And then his wife died of lung cancer after that. And that was because she was afraid of him dying. But her cancer would have stopped immediately after he died because she was no longer afraid of him dying. We actually have a case like that. So this is the chart that Dr. Hammer developed and that we're going to follow, and piece by piece as we go through the laws. So here, following my arrow, is normal day-night rhythm. So the top part of the graph is the sympathetic nervous system, so fight or flight. And the bottom part of the graph is parasympathetic nervous system. So we have these two parts to our nervous system. And the sympathetic nervous system is more active during the day. So this is daytime. And then around 6 o'clock, we start getting more tired and the parasympathetic nervous system takes over. And that's when that allows us to rest and to heal and to rebuild from the stress of the day. So we're going along happily, and then bang, we get hit by a shock. In German New Medicine, Dr. Hammer coined these shocks as Dirk-Hammer syndromes, so DHSs. I don't use a lot of the terms, at first at least, because I find it easier to learn something if we just use common language. And that what happens then is we get catapulted into the first phase of the shock. So now we'll go to Law 2. So Law 2 says that there are two possible phases for each shock, active and healing, each with its own clear symptoms. And that Dr. Hammer's chart predicts the course of disease through these two phases. So let's go back to the chart. So in the first phase, as I mentioned, we have sympathetic nervous system. And the symptoms, the general symptoms that go along with this are feeling shocked, feeling conflicted, also this often goes along with feeling isolated or isolating oneself. The extremities tend to be cold, so cold hands and feet. Our appetite can be affected, go way down, and we wake up really early in the morning. There's also a specific symptom that goes with the shock. So for instance, the one we described as the lung cancer. So if this DHS or shock was a death fright, then the specific symptom in this first phase would be the growth of the lung cells. Now, if there's a resolution, and in German New Medicine, this is the CL or conflictolysis, so conflict breakup, the nervous system switches from sympathetic or stress to parasympathetic or healing. So we call it the healing phase. And the healing phase has two parts. The first part, and I'm not going to go into depth with this, but in the first part, we tend to retain water, and the water helps us heal the stress damage. Our hands and feet get warm, and further, we might even have a fever or an infection. And we start being more relaxed. We're no longer feeling so stressed, at least about that issue. I mean, we can have several of these programs running at the same time. So even though we might resolve one shock, we still might have some degree of stress about other shocks that are unresolved. And most of us carry unresolved shocks, even from childhood. But let's just look at this one shock. So we have the stress phase and then the healing phase in two parts. And in the middle of the healing phase, when there's been enough water retained and enough healing happened, the brain will then stimulate, return to sympathetic mode. Like it'll return the shock phase a little bit in order to signal to the body to start returning back to life, to get out of this tiredness that happens when we're in healing phase, which is actually very important to know, because sometimes in healing, you can actually have debilitating fatigue. And if you know that, then you don't think that you're sick. Because I'm going to have some people come to me, and because they don't understand that healing includes fevers, that it includes all kinds of other symptoms, different for each shock, they think that they're still sick. And that stress of feeling like they're sick will keep those symptoms locked in. It's similar if you take medication that suppresses the symptoms. It'll stop the body from continuing along this path. And another thing that will interfere with this healing process would be if we get re-triggered into the shock. So this happens a lot if people have been sexually abused. Then they'll see an image or they'll see a person that reminds them, or they'll be in a situation and they'll go into a panic mode and go back into conflict active and then gradually come back through here. But we call it a hanging healing. They never quite make it through to the other side. They can't heal the thing deep enough so that they're not triggered. And what happens with a hanging healing is actually hugely significant, because part of healing is inflammation. So if you're in a hanging healing, if you have a shock that's not being resolved or that keeps being re-triggered, you have this chronic inflammation. And in natural medicine and also some mainstream medicine, the inflammation is the culprit. And so we have all of these medications and natural remedies for inflammation, but really that's a Band-Aid. And what we need to do is resolve the shock. We need to identify and resolve it, because sometimes we don't even know that this is going on. So Law 3 is probably the most amazing to me. As Dr. Hammer was observing different patterns in his patients, he noticed that they fell into two types, depending on whether the shock hit the old brain or the new brain. So in the old brain pattern, that's like the lung cancer that we just described, there's a growth of cells in the active phase. And in the healing phase, the cells stop growing, period. The new brain pattern is a little bit more complicated. In the shock phase, the particular tissue that's responding to the shock that will eventually help us has an ulceration or a cell loss. And the kicker is that we don't know that's happening. It tends to be asymptomatic. We don't feel it. There's another thing that can happen to a new brain part, and that's loss of function, like a paralysis. And in these new brain patterns, when there's a resolution, then these things reverse. So the ulceration or the cell loss starts to fill in. And in some cases, this healing process will grow larger than the original tissue or organ, and we call that a cancer, when it's not really a true cancer. It's actually a healing phenomenon that will stop on its own. So most of the cancers that we've had such good success with at our clinic are these healing cancers. And you can really tell people are less freaked out about a healing cancer than an active cancer, because when you have an active cancer, in other words, cell growth in the active phase, when you're still in shock, you're already in sympathetic mode. So you're already inherently stressed. Whereas if you have a healing cancer, your whole nervous system is already gone into parasympathetic. You're already somewhat calmer. And so you can handle that diagnosis better. And it's easier to even accept that this can be a healing. And the other thing that can happen in a healing phase of a new brain tissue or organ is that the function will be regained. So examples, glandular breast cancer, basically that's a situation where a woman has a deep worry shock for a loved one. And for instance, a child who gets injured. So that woman, if the shock is long, because you don't get cancers in a few days with these shocks. Don't walk away from this thinking, oh my God, I'm going to get a shock and I'll be sick. It takes months to be in the shock, and they have to be fairly deep shocks. You can't watch TV, see something horrendous, and get sick from it. It's usually things that are quite close to us. So we have a woman whose child is injured, and the injury takes a long time, and the mother is afraid, maybe even for the child's life. The child might be in intensive care or in the hospital. And the body instinctively, through a 1,000,000-year-plus program, will start growing breast gland cells. It's like this instinctive urge to nourish somebody close. And we are not aware, we don't connect to that anymore as modern so-called civilized people, but our bodies still do it because we haven't yet made all these, we haven't become aware of these things to the point where we can diffuse them. So, but then, so maybe in 3 months, the woman might feel a little lump, and that would be a glandular breast cancer. But when that child is well and the woman stops being shocked, the woman comes out of the shock, that lump will stop growing because there's no need anymore. And it's that simple. And we have amazing case studies that show this. An example of a new brain cancer is a cancer of the ovary. So the story here is that a woman experiences a death shock, not a death fright, as per the lung cancer, but the shock of somebody close dying unexpectedly and not taking it well. And if the shock goes on for months, the ovary, being a new brain-related tissue, will start to ulcerate. Unbeknownst to the woman, you don't feel that. And after slow down. Once the woman is out of shock, that ovary will start rebuilding itself in 9 months because the ovary is tied to the pregnancy cycle. And if this is found by a medical doctor in those 9 months, that ovary is then diagnosed as having cancer. If it's found after the 9 months, because it stops growing at 9 months, it'll be called a benign ovarian cyst. And the biological purpose of this, because remember, all of these tissues are trying to help us, is to try to increase the woman's fertility. So bigger ovary, more hormones, more ability to have another child to replace one that was lost, or more hormones, being more attractive. If you lose a mate, you can attract another mate. And so in modern medicine, if you try and fight this and chop out parts, the body keeps trying to finish the program to help us. And so then they say, well, this is a very aggressive cancer, and they keep treating it aggressively, and eventually we die of the treatment. Or if we're very strong, we get through the treatment. If we work with that program and understand that the ovary is trying to help us and it'll stop growing by itself, there's nothing to do. So we have 6 out of 7 cases of cured ovarian cancer. where it comes to being a cyst, stops growing, and that's end of game. So you can see this is why I'm so excited about the third law, because often when people come with a new brain cancer, sometimes it's already finished growing. And you can say to a person, you have to explain all of this. You can't just tell people what to do. But if German New Medicine makes sense to them, then you can say, well, you can just wait, keep getting monitored, and this may have finished its course already. So hugely wonderful. An example of the functional stop and start might be MS. So MS, paralysis, responds to motor conflicts. And the motor conflict is when there's a shock related to arms and legs and movement. For instance, not being able to run away from danger, or not being able to grab somebody to save them from something. And we know from the animal world, when there's a motor shock, like a deer runs away from a lion and survives, they go to a place somewhere and they start to shake, and they shake the shock out. And then it's gone. Or they might freeze to get through the danger, to not be seen. So that freeze, Parkinson's would be the shaking, and MS would be the freezing. But once you resolve that shock, the function will come back. The problem with MS, or the situation with MS, is that when you get a diagnosis of MS, it's another motor shock. In other words, you might be in a wheelchair, is a motor shock. You won't be able to walk. And so we then are creating the MS by misunderstanding it and giving these prognoses. So you can see that the significance of this law, in my mind, is the biggest thing that could happen to medicine if we could incorporate this re-understanding. So, following the chart, we have the old brain, cerebellum and brainstem. When there's an old brain shock, like a lung cancer, like the breast gland, you have cell augmentation. So you have cell growth. And when you get into the healing phase, you have that stops. We're going to talk about microorganisms in the next law. So here we have the new brain tissue, cerebellum, and the frontal lobe. These related organs and tissues lose cells, like you call it necrosis or ulceration, or functional change. And then when you get into the healing phase, if you get into the healing phase, you have cell augmentation. So the cells grow back or the function recurs. And I have to say, I've watched my teacher cure an MS over the phone in 15 minutes. And it explains, so for instance, going to naturopathic college and in medical school as well, MS is explained as a systemic disease, as a disease of the nerves. So why is it only in one arm? Why is it only in one leg? And that's symbolic for the shock. So for instance, Iltadora has this amazing case which she allows me to describe. She had a woman in her 30s come to her with MS, and she had this typical foot drag where she couldn't really move her left leg very well. Now one thing that Hammer discovered is that there's big significance to right or left-sidedness, or dominance and non-dominant side. So your dominant side, whether it's right or left, relates to most people you're close to. But your non-dominant side, for most people, your left hand, but for left-handed people, their right hand, relates to only mother and children. So this woman was right-handed, and it was her left leg that was a problem. And so Iltadora asked her about, when did this paralysis start? and what was her relationship like with her mother. And the woman described this episode that she had as a teen, where the mother had taken something and was going to throw it at her, and the teenager tripped and fell, and Ilse-Dora asked the most brilliant question, "What did you do with your left leg?" And the woman said, "Well, I pulled my left leg up to protect myself," and had this awareness that here was the shock of the left leg, and got up from the table without the foot drag. Law 4 is also quite counterintuitive. So Law 4 says that microorganisms help us in the healing phase, and that they're also related to a specific brain level. This was long observed in homeopathic medicine, that when people got infections, that tended to be part of healing. And I also noticed this in my practice. I'd see that if people had chronic illness and we did what was needed to get them well, they would have some kind of infection, often flu-like, just before they got well. And they often got dramatically better after having this flu. And it got to where I even started preparing people and framing it as this wonderful thing that could happen to you if you have a flu in the process of trying to get well from a chronic disease. And saying, cheer, call me, please don't medicate. And when you get through that, you'll be stronger than ever. Furthermore, let's see what Hammer talked about, the different brain correlations. So he observed with that keen mind of his that the different infections and organisms were related to specific brain levels. So he noticed that organs and tissue related to the old brain had healing infections involving fungi or tuberculosis. Midbrain, which we haven't talked about because it's basically partly new and partly old brain, have bacterial infections. And the new brain is the most interesting of all, because Hammer hypothesized then that if there are viruses, that they would be helpful. And he really doubted that viruses existed. And there's now this new research about exosomes. Dr. Kaufman, if you want to look it up, Kaufman, and exosomes. And he discovered these small particles that look exactly like the viruses that we think exist. They get expressed by the cell when we're in stress and when we're trying to fight something. And they're there when we get sick. And so modern medicine may have, this hasn't been fully finalized yet, misunderstood these particles as something called viruses that come from the outside, when really they're expressed from inside the cells. So it's hugely controversial, but it makes sense with the German New Medicine, with the other laws. And it makes sense with what I've seen in practice. I have not seen things be contagious. I have never caught anything from any of my patients, despite being in pretty close contact with them. So that all of these microorganisms help the body recover. And in the old brain scenario, those microorganisms would degrade cells that are no longer needed. So in the form of the lung cancer, let's say you get over this fear of death, the tubercular bacteria, they're called mycobacteria, come in and degrade those cells that are no longer needed, and then it stops by itself. Because we have classified it as a disease and we fight it, it's not a very smooth process, and we can actually help people die by having misunderstood all of this. And in the new brain system, the bacteria or the viruses help the tissue rebuild. So the significance is that we can let infections run their course as part of healing unless they're dangerous. And if they're too uncomfortable or dangerous, homeopathy is hugely effective for treating infections, even very difficult ones, and doesn't cause antibiotic resistant bacteria. And we could leave the antibiotics as a last resort. I mean, everything has a use in some way. So here's our chart again. And so filling it in, we have an old brain shock where you have cell growth in the conflict phase trying to help us. So like the breast gland, like the lung cells trying to help us with the shock gets sorted. And then if we have the correct microorganisms, and sometimes we don't if we're vaccinated, a lot of people don't have TB, for instance. And if we don't have those microorganisms, that lump or those extra cells will just go dormant. They won't get degraded, but they'll just go benign. And in the new brain, you have the shock, you have tissue ulceration or loss of function, and then you would have a bacterial or a viral or exosomes to help rebuild it. And there's an interesting study that goes with Law 4, and it's a medical doctor, an oncologist at the turn of the last century in New York City. And he had a huge question. He said, I can't predict which of my patients live or die. It doesn't seem to follow a pattern. So he drilled down and did more research, and he found out that those people who survived were usually the ones who had fever and infections. And somehow we've never made use of that, but here it is coming back in German New Medicine. Also in homeopathy, fevers are seen as hugely helpful in healing. Law 5. So Law 5 we've sort of paraphrased already, and it's that diseases are special programs of nature designed to help the individual or the species, so that when we get through a healing phase to the end, we're stronger in some way. So an example would be bone cancer, and it's the same as breaking a bone. It's pretty well known that when you break a bone and it heals, it's stronger in that place. It's the same with bone cancer. Where the bone cancer was, when it heals, and we've seen bone cancer heal with German New Medicine effortlessly, it's stronger in that place, and therefore more resilient to the kind of shocks that would be reflected in arms and legs. So the significance is we can learn to trust our bodies and allow them to heal with a minimum of intervention, saving time, energy, and money. So our little clinic alone saved OHIP, our provincial health insurance, over $2 million, mostly in cancer treatments that were no longer needed. So you can imagine what it would look like if our medical system could start to integrate this. In our cases, patients survive their prognoses by years and sometimes decades and are often still alive when sometimes they only had months to live. We started the healing house at about 2008. And I remember we had one patient come who had 1 month to live, and she stayed with us for 2 years and got rid of 2 cancers and still had a chronic condition when she left, but she was pretty lively. So it's been a huge inspiration for me to see these patients of mine understanding this and just grabbing it and going with it. So we already know this chart. So let's talk about how we would use German New Medicine. So the first prerequisite is that we study German New Medicine and make sure that it makes sense to us, that we're not doing it because a practitioner is telling us, and we're also not doing it because we're desperate. That's a big mistake. It needs to make sense, and when we study it, we have this calm and we have this reassurance and we feel like we're on the right path. Those are the people who do the best using this. And it's really important not to push this on anyone because it doesn't work like that. It has to come from the inside out. So the process of using German New Medicine is, first of all, we determine what the shock was. And this is fairly easy to do because Dr. Hammer has developed a huge chart that correlates most of our diseases with the kind of biological shock that would trigger it. So once we know the shock, we go looking for it in the person's life, and then we determine what phase the patient or we are in, active or healing. So if we're in active phase, we have to resolve the shock in order to get better, or at least downgrade it, which is quite hopeful. We don't have to fully resolve it all the time. If we downgrade it, it can very much slow down any of the physical reactions or responses to it. If we're in healing phase, however, we have to learn what kinds of symptoms are likely to happen to us or understand the symptoms that we already have and be able to ride them out with whatever works and try to avoid triggers. We really have to become aware of what triggers us and how we think about things and how we respond to things, because we can get triggered almost unconsciously. And then it's very hard to work with it because we can't control it then. We're just responding automatically. We're responding on a primitive level. We have to bring our awareness up to where we see things consciously, and right away then the body will start to slow down its response because we're handling it here. The body doesn't have to handle it. So it's good to cultivate a process of self-awareness, which is good for our spiritual growth anyway, to prevent future shocks from taking hold. So mindfulness meditation, journaling, talking. Dr. Hammer would say it's one of the best things we can do after we have a shock. Don't isolate. Talk it out with people. And often you'll find people doing that instinctively. They'll talk, and it's sometimes kind of hard for the people around them because they go over and over it, but they're getting it out of their system. And you can use almost any kind of medical technique or product or herb or drug with German New Medicine. German New Medicine doesn't tell you what to do. It gives you principles, and we have to understand them and know how to use different techniques to get through. So in the active phase, for instance, there'd be a lot of techniques for resolving. So EMDR, different kinds of counseling, energy medicine. And at the same time, we would use, well, for me, I would use natural remedies to help the body, and sometimes surgery, drugs, and I've even seen cancer cures with a combination of German New Medicine and X-ray and radiology. So everything can be mixed together according to what exactly is needed. It has to be assessed. And maybe one of the biggest things to mention here is that not everything is German New Medicine. So sometimes a disease will be caused by a structural problem. The spine is out and the nerve flow will be wrong to an organ. Or it can be toxicity and poisoning. So there are different things. It can be nutritional deficiency, a severe one. So one has to really assess, is this truly German New Medicine before heading off to do emotional work for something that needs a chiropractic adjustment. And the other thing, why I wrote Keep Studying, is because what I've observed with people is that they'll start all gung-ho with German New Medicine. It's the best thing they've ever seen. They have full confidence in it, and then they'll start sliding. They'll have this symptom, or they'll have pain. Often there's pain during healing because of the inflammation. And they'll start to have doubts, and they'll start sliding back into what they've believed most of their life, and they won't even notice it. So it's really important, and I highly recommend that you read my book, take courses, keep talking to people, because this will make you very resilient to diseases. It'll help you prevent diseases by knowing this material. And what we're saying today is the tip of the iceberg. I really would encourage you to keep going, which brings us to resources. So I know it sounds self-serving, but I like my book. I think it's a good explanation. So it costs $20. It's not expensive. You can get it at Amazon or at our clinic. You can get the ebook for a few bucks. And it will tell you a lot more of what you need to know. For instance, the role of fear or the mental possibilities. There's a lot more to it. And we'll do further webinars to explain some of these details. If you're interested in working with me, we have a very careful procedure where you would start with a screening questionnaire and then have a free consult with me, because I only take people who I think are good candidates. I do not want to waste people's time and money, and I don't want to watch disasters happen. So if someone's not a good candidate for me, I will refer them either to a higher up German New Medicine practitioner, because I'm basically not a specialist in German New Medicine. I'm still a general practitioner, and I integrate it. And yeah, so I might refer you back to another naturopath, or maybe even medical people, if that's what I think is best. And of course, I would say why. The other option you have is study German New Medicine for yourself and be your own practitioner and teacher. And I highly recommend Ilse-Dora Laker, who's my mentor. She's one of the best on the planet. She studied closely with Dr. Hammer and has a depth and breadth of knowledge that is astounding. She's also quite brilliant intuitively. So the webinars that I'd like to do coming up is German New Medicine and Diet, which would include allergies and detox. I've observed some very interesting patterns which combine naturopathic medicine and German GNM. GNM and joint pain. We've seen such good results with joint pain, including a gentleman in his 70s who was scheduled to have a hip replacement who never needed it 10 years later, and in 3 months. And German New Medicine and cancer, more specifically. So we have a newsletter you can sign up for on our website, ecowellness.com, and you'll be notified by these things. So we are at questions and answers, where Rebecca takes over.
Yeah, wonderful. Thank you so much, Katherine.
That was fun. It wasn't as bad as I thought it would be.
No, you did a great job. This is a new platform for
Yeah.
Katherine. She's used to doing things in person.
Yeah,
But this is great. And we've got lots of great questions for you.
Great.
So basically,
Love
I'm going
that.
to go through them in order. We should have time to be, I think if everybody's okay with going a little bit past 9, then we'll be able to sort of address everybody's questions. So the first one was from Samar, and she's asking, does GNM assist with fertility?
It can. It can if the fertility problem is related to a death shock. And that's a very good question, because when you have a death shock that's strong enough, in other words, somebody's died and you've really hit hard by it, it will actually decrease during the shock phase the ovarian capacity. But one also has to make sure that real basic things are not being missed, physical things, physical fertility things, like the guy, do a sperm count. So that's why I like being a naturopath and using German New Medicine, because it just broadens my scope of different things that can cause disease. I'm not a purist. Good question.
Thank you.
Does that answer your question, Samar, or did you have anything follow up?
Yeah, that's fine. Thank you.
Great, thanks. Okay, so the next one was me. So as you were talking, I was thinking you're talking about the fear of death and the lung cancer. So I was wondering, does that mean if you're afraid of something, does that mean that you're always going to get cancer, or is it not always?
No, it's not always. Fears can cause all kinds of things. And one of the biggest, I have a whole chapter on fear in the book, because fear also hits the kidneys. And it's something called kidney tubule syndrome. And it's, again, one of those brilliant things that Dr. Hammer observed. that when we have a fear of, it's a fear of dying, but it's more the fear of not being with our people. We're not afraid of death itself. Being afraid of death itself, that's the lung response. But being afraid of leaving our people is a kidney response. And the kidneys will actually shut down and retain water. And the theory is that we want the water so that we can get to our, being lost in the desert, away from our people, and we want to retain water so that we can get back to our people. But when we have this kidney tubule syndrome, that water will go specifically to the areas in the body that are healing. So let's say we had a healing cancer that will swell the lump. So I've actually, I often warn people about this and say, if you get scared, your lump it could double overnight. That's not cell growth. That's water swelling. And I've seen that happen, reminded the people, they go, oh, right, that, and pee it all out and the lump's back to normal size the next day. So that was a really good question. I didn't include that here, but it's a good thing to include. Thanks.
Great, thanks.
Mm-hmm.
The next one was from Lynn. So she put in here, so this suggests that everyone who has trauma will get cancer.
No.
Is the answer regulation of the nervous system?
Yes, in a way, because if we regulate our nervous system, in other words, learn to relax, our bodies then can heal on all these levels. Cancer, because I've had so much experience with cancer, with German New Medicine, it's kind of my go-to for examples. Most of our other diseases also fall into that. And it can be arthritis. It can be an ulcer in the stomach. It can be a skin rash. It can be swollen glands. It can be an eye infection. So no, cancer is just one kind of response in German New Medicine. And sorry I didn't clarify that. And thank you for that question.
So thank you for your.
We lost.
Sorry, I'm
Go
not
ahead,
there.
Lynn.
We lost you.
So never mind. I feel like this is a much bigger conversation. So thank you for your answer.
Yeah, good. Thank you for your question.
Great. So again, this was me. Medical diagnosis is causing new shocks in people. And is that what's then creating this hanging healing? If something happens to us, we go see the doctor tells us, oh, you've got this big bad thing. So then you've got like, and then.
Yes, we call that prognosis shock.
Uh-huh.
Worse than a hanging healing, a prognosis shock is usually responsible for what we call metastases. In German New Medicine, Hammer explains that there's no such thing as a metastasis, that cancer does not spread from one organ or tissue to another, that there's never been any proof or mechanism of that happening, that these so-called metastases are new shocks caused by the diagnosis of the first one. So thanks for that question too.
And you talked a lot about this new brain, old brain thing.
Yeah.
Where and what is a new brain versus an old brain?
The new brain is more the front part of our brain. It's the evolutionary age. So as we evolved with this little, the back of the brain stem, and then as we evolved into people, we got bigger and bigger brains, and this frontal lobe is the cortex, the most recent evolutionary part of our brain, and that's why we call it the new brain.
Okay, that makes sense. You mentioned about the TB piece, and I think what you were saying is if you were not vaccinated for TB, then TB could actually happen as part of the healing process.
Yes.
With an old brain cancer?
Yes.
So the actual vaccine that's keeping us from getting TB is preventing us from healing some cancers.
No, the cancer would still heal. In other words, it would stop growing. It just wouldn't degrade. And
it wouldn't go back to its regular size. It would stay big.
It would just stay. And you could have a simple surgery to cut out the lump. But you know, it's a blessing not to have TB. I've seen these
Mhm.
TB healing infections, and they are messy and smelly, and they trigger people. They trigger people into fear because we have no context in our medical system to catch this. You know, I don't have a hospital, you know, at my place. I have to have people pretty functional to come and stay. I don't have IVs. I don't have the things, you know. So we often recommend that women have lumpectomies to avoid some of the messy healing phase. And some people do and some people don't. And sometimes it can get pretty messy and we bumble through.
Okay. So Jenna asked, you mentioned that your clinic saved $2 million for OHIP. Are your services covered by OHIP or any extended insurance plans?
Yes, most extended insurance plans, not OHIP yet. I mean, hopefully, as research starts happening, at some point, some medical student or doctor will discover this and go, yes, I'm going to research this. And the foot will be in the door. And this will start, you know, now with internet, things can move very quickly. And who knows? I mean, 10 years is very quick. So
Thank you.
Does that answer your question, Jenna?
Yes, thanks so much.
Yeah.
Great. So then Lori was asking, have you used GNM with alcohol addiction?
I have. And it's not a big part of my practice. I've done it twice. And basically, it's not something I do on my own. I always work with professional alcohol addictions people. So my part of that would be to determine what are the shocks. Because if you have two shocks in the same brain level, you'll create a mental disease. And so my part would be identifying what are those shocks so that we can help cure. It's not easy, but it can.
Okay.
I mean, it can be. I shouldn't say it's not easy because in some cases it actually is.
Mhm.
Mm-hmm. Okay.
Does that help you, Lori?
Yeah, thank you.
Great. The next one was Michael. What's the range of duration for the active and the healing phase? And can you possibly get stuck in the active phase?
Yes, it's actually quite common. So the active phase can be decades long, and the healing phase can also be decades long if it's in hanging. I mean, I think a lot of chronic disease that we see are part German new medicine and part lifestyle. And we know a lot of our lifestyle things cause inflammation. So it's not just these unresolved shocks. It's also what we eat. Like wheat causes inflammation. And I don't say never eat wheat, but you know, don't live on it. Or stop eating it to break the cycle of inflammation. Anyways, that wasn't the question. So the answer is it can be decades, and often is, because we don't live in a culture where we understand healing yet.
If the healing isn't in a hanging phase, like what would maybe the natural duration be?
It depends. If it's one of the glands that's tied into the pregnancy cycle, so those are the reproductive glands, the healing phase is always 9 months. The rest of the healing phases some of them have their own times, like skin, joints, take about 6 to 8 weeks. Like if you have a skin rash, which is the resolution of a separation, if it's not interrupted and if it goes smoothly, it's 6 to 8 weeks. Joint pain also 6 to 8 weeks. The interesting thing is, if you add energy medicine into the mix here, you can have it in seconds. So for me, German new medicine isn't the ultimate, but it's the bridge that we need to then move forward to do proper energy medicine. In other words, we're not fighting things that we shouldn't be fighting. This energy medicine, I mean, I've seen it heal a cancer in 1 day where the person was ready to die. It was Reiki. So that's totally out of the German new medicine box. So, but German new medicine has these pretty clear timelines. And for some organs and tissues, it's dependent on how long the active phase was. then the healing phase will also be long. So all the different organs and tissues have their own kind of guidelines. Good question. Lots of good questions. This is great. All these things I should have included.
Oh no, it's great questions. Michael, did that answer that sufficiently for you?
Yeah, I'm just thinking about, just like an emotional, like an emotional event, like how long for the healing. I mean, maybe you just can't tell. I mean, I suppose they're all different.
It's different for different people. And it very much is dependent on a person's circumstances, i.e. whether they're being re-triggered or not. And unfortunately, one of the biggest factors of this is money. We have lots of research that shows that the biggest factor in people being able to recover is having financial resources. Yeah. So then that skews, I mean, then people can be sick their whole lives. They don't have the resources to do any of this. They're stuck. And our system, I think, is being shaken up right now. It's coming unstuck. And hopefully some of these imbalances, we can rebalance them. We'll see. Do our best, right?
Yeah, thank you.
And then we have one more from Lori. How would one use GNM to prevent a hip replacement?
So joints respond to devaluation. And hip joints, the devaluation is either sexual or kind of carrying too hard a load. And for this person, it was a sexual devaluation. And so what I did with him, I discussed it with him. He denied it totally. And what I recommended is that he have a weekly massage so that he be touched. And that resolved it for him. He didn't resolve it consciously, but knowing what I know about German medicine and how to make him feel valued, because he'd had a very bad marriage breakup that just destroyed him and made him feel devalued. And these weekly massages with this lovely massage therapist restored. And so, and basically also telling him the German medicine theory of this is going to take 6 to 8 weeks and then it will stop hurting. And all of that together. And then I also did anti-inflammatory to help break the cycle. And within a few months, no more pain. It was great.
Cool.
Yeah.
That's all the questions we have in the chat window. But if anybody has any other questions that they want to ask, you could just go off of mute if you're on mute and shoot. And I guess if we don't have anything else.
I have one.
Yes, great. Go ahead, Marcy.
Hi there. I'm a patient of Dr. Willow's. My name is and so in your book, Dr. Willow, on page 60 with the bone tumors,
yes,
through all the parts of the back except for the part that's in my back, where the tumors are in my back, which is the lower back. And so I've been burning to ask you this. I know I'm going to make another point.
No. This is perfect. So that would be lack of support. The shock of feeling unsupported. And so feeling like lack of value because, oh, no one's supporting, or thinking that we're not supported.
And so you're not talking just financially, it could be emotionally, it could be
anything. Could be anything, right?
Okay.
Because our lower back is our main support place.
Right.
Yeah. Nice to see you.
You too. Thank you.
Yeah, thanks too.
Thanks for doing this webinar.
I've actually had a lot of fun. I actually stopped being nervous, and this is great.
Good for you.
Thank you.
Edmund, by all means, go off of mute and say hello to Dr. Willow.
Hi, Dr. Willow. This is Eddie. Well, I was at Carbridge, so we chatted, and I think we were. Anyway, I saw you last year, and great to see you again.
Yeah, likewise. Thank you.
Thanks for the session tonight.
Oh, it was my pleasure. I love sharing this. It has so changed my life. Not only my practice, also my personal life. It has saved me so many times. Unbelievable.
So this is wonderful.
Yeah.
So we've been recording this session. So this will go up hopefully on the internet, as long as it looks like it's okay and turned out all right. And Dr. Willow now has a YouTube channel. So as videos get created like this that have lots of information on German New Medicine, they'll go on her YouTube channel and you can follow that.
Thanks to
And
Rebecca.
yeah, we'll do what we can do to get the word out there. Yeah, tell your friends, send them her way, take a look at the book, and yeah, hopefully everybody stays in touch. Now, somebody from this session will get a free consultation, a GNM consultation with Dr. Willow. So we'll be getting in touch with the lucky person there.
That was Rebecca's idea too. It's brilliant. So we can finish with the final meditation with another ping. I love these chimes. And during the ping, we can imagine ourselves moving another step towards glowing health. So thank you again. Wishing you well. Okay, so I'm going to stop recording.
Thanks, Dr. Willow.
Ah.